Hi everyone, my name is Allison Lucchese, and I'm an associate marriage and family therapist here at Embracing You Therapy. For today's topic, I wanted to shed light on a treatment modality specifically for OCD called ERP. ERP stands for Exposure and Response Prevention and actually falls under the umbrella of cognitive behavioral therapy. The exposure part of ERP refers to confronting the unwanted, intrusive thoughts, images, objects, and even situations that make us feel anxious or provoke our fears/obsessions. The response prevention part of ERP refers to making the choice to not do a compulsive behavior once the anxiety or obsessions have been triggered. So again, as a quick review, we basically try our best to identify what the OCD cycle is. So again, we have a fear that becomes the obsession that then triggers an anxiety response. The anxiety response then leads to a compulsive act that is meant to reduce the fear, which is our obsession. So once we can identify what the OCD cycle is for an individual, here at Embracing You Therapy, we create an exposure hierarchy list. So where together we come up with, again, what the obsessions are, what the compulsions are, and then we assign something that is called a SUD scale. So the SUD scale stands for Subjective Units of Distress, and we can assign different ratings for it. So an example, we can assign a scale from 1 to 10, a numerical value, or we can do low, medium, high. So to try to make this very easy to understand, say I have contamination OCD, and say one of my obsessions is if I don't wash my hands 5 times, then I will spread germs and I will get sick. So to give you a brief example, the obsession is my fear of making sure my hands are sanitized and clean. My compulsion would be need to wash my hands 5 times. My SUD scale, let's just say I will assign it a numerical value of 4. So that's my low. Then let's move on and say if I don't disinfect my stove or if I don't disinfect my floors, say I'm gonna add another numerical value, say 3 times, and if I don't clean it with bleach or if I don't clean it with something, with a strong cleaning material, then my family will get sick. And for that, I want to give it a SUD scale of 7. So basically, once we're able to identify all of the obsessions and all of the compulsions, and we give it a SUD scale, we basically see what takes top priority. What can we do in terms of an exposure, and how can we prevent our compulsive behavior? So one thing that I really want to stress in this video is the importance that every single exposure that we do must have a purpose. So for instance, gonna go back to the hand washing example. Say I wash my hands 5 times, it's what I'm used to, that's my compulsive behavior. Now my exposure is gonna be, well, maybe I'm only gonna wash my hands twice, and then I'm gonna walk away and I'm gonna keep doing what I would normally do. Will this increase my anxiety? Yes. But the goal of exposures and the goal of doing this type of treatment modality is so that we can start increasing our tolerance for the uncomfortable, right? So another thing that I tend to tell clients and that I tend to keep in mind is, how would my life look like if I didn't have OCD, right? And here's where we also go into value-based decisions, fear-based decisions. My fear-based decision is going to reinforce my compulsive behavior. But my value-based decision is, I wash my hands once, my hands are clean. Now I need to go on and do something else that I was normally going to do anyway. And so when we begin this type of treatment, Yes, it is normal for anxiety to increase. The thing though is if we stay consistent and if we can do exposures in every session, and if you can continue to do exposures outside of sessions for about 15 to 20 minutes every single day, then the anxiety decreases. You learn that the obsessions and you learn that the compulsions are not going to help the obsessions. You learn that the obsessions and the fears are not going to harm you and that your thoughts are not going to harm you. So I know, sounds easy, all said and done, but it does take a lot of work. And it's something that, again, we go at the pace that you are ready to go to. So if you have any additional questions regarding ERP, if you're wondering whether or not it's the right fit for you, please feel free to give us a call and we'd be more than happy to answer any questions. Or again, leave a couple questions in the comment box below. Hope everyone has a great evening and